Oh, hey, Jared.
Well, hello, Shelby. How are you?
I'm good. I'm the student nurse today. Do you mind if I follow you around?
Oh, I am so lucky. Absolutely.
Can you give me the S bar for your patient?
Absolutely. Today we are taking care of Miss Marta Yarn. She's an 80-year-old female, room 429, being seen by Dr. Jolly. She's 175 pounds, 5'5", and a full coat. She is here because she has a non-healing sacral ulcer, which is stage 3, for about 3 months now. And it first developed about 6 months ago when she was hospitalized prior for a different reason. All the treatment's been unsuccessful so far. Outpatient, so they admitted her after her doctor's appointment to the hospital now, so we're taking care of her. She's currently alert and oriented ×4. Neuro exam was unremarkable. She's pleasant to talk to. Good spirits for everything considered. Head to toe exam finds a sacral ulcer, obviously on the sacrum, stage 3. So we're taking care of that with some barrier cream and some dressings. Everything else is unremarkable. She has chronic pain, she says, all over her body, which is about a 3 out of 10 right now, but she's receiving PRN morphine, but we're not giving that right now, we're giving a different medication. And the recommendations that we're going to give is to administer her antibiotic or anti-infective for the infection. And we can determine that by the blood cultures that came back that said she had that she tested positive for E. coli, and her white blood cells were also elevated a little bit. No other signs of sepsis really. Her temperature wasn't elevated significantly, 99.1. All other vital signs were the normal limits. And we're going to take care of the wound as best we can, keep rotating her every 2 hours, and make sure she's comfortable.
Okay. Why specifically is this client receiving the medication you're about to give?
Like I said before, it's an anti-infective, and Miss Yarn has an infection. Now, gentamicin works on gram-negative bacteria, and E. coli is a gram-negative bacteria. The way it works, it's a bactericidal, and it inhibits protein synthesis at the ribosome level for the bacteria.
Okay. So that answered my question of how the medication or what effects it has on the body. So
One step ahead of you. That's why you're the student and the teacher.
Thank you.
Yes, ma'am.
When should you question administering this medication?
You're going to question administering this patient in severe sepsis, or and another reason, or side effect, I'm sorry, is severe neurological deficits. Blood draws that don't come back with elevated white blood cells. Nephrotoxicity, hepatotoxicity, it's very nephrotoxic to the patient, so we want to monitor all the lab values for renal function, BUN, AST, ALT, creatinine, all things like that to make sure that everything's okay with the patient and she can handle the medication that we're about to give her.
Okay. Does this medication have a therapeutic serum level?
It actually does. We're going to want to administer a blood serum test about 30 minutes after we give the IV injection, and we're going to want to have about 4 to 6 micrograms per milliliter thereafter for that serum level to be effective for the patient.
Okay, and then which vital signs are you going to monitor?
For her, typical sepsis vital signs because they just have bacterial infection. We're going to do blood pressure, heart rate, temperature, respiratory rate, skin temperature, and also, like I said before, a urinalysis for renal function, BUN, creatinine, AST, ALT, all that good stuff.
Okay, which physiological parameters should be monitored when the medication is being administered?
Pretty much just what we're on beforehand is the IV site for infiltration, any hypersensitivity and allergic reactions. Like I said before, her chart says that she has no history of allergic reactions or any allergies, so that shouldn't be an issue. But again, any pain around the site, any diaphoresis, any lightheadedness, any neurosensory deficits, because this medication does have side effects which can affect her hearing sites and cause some vertigo and ataxia.
Okay, what interventions must be taught to the client to ensure the medication is administered safely in the hospital and at home?
Once again, we're going to teach the patient the signs and symptoms of this medication, the side effects and adverse reactions of this medication. Check for infiltration on the IV site. She's not going to be on this IV at home, so we're just going to be doing it here. She should monitor over the next 3 to 5 days, and if that doesn't work, this medication, we're going to switch it and draw some more cultures and see if another medication can be effective. Like I said, check for redness, check for warmth, check for pain around the IV site. Have her drink plenty of fluids because I said this medication is very nephrotoxic, and she has a history of dehydration and also a history of electrolyte imbalance. So we want her to be very hydrated, especially if she's battling this infection.
Okay, and what are the side effects and potential adverse reactions?
For her, it's going to be a possible vertigo. She is a little bit elderly, so she can have an issue with lightheadedness and dizziness. Ataxia, or like I said, loss of control over bodily movements, which is a side effect of this medication. Ototoxicity, possible hearing loss or toxicity to the eardrum. Also going to have nephrotoxicity, once again, the kidneys and liver. And also going to have muscle paralysis and, like I said, hypersensitivity. But she has been having this medication administered already, so that shouldn't be an issue.
Okay, and then how do we know the medication is effective?
Medication can be affected by her white blood cell count. It's going to be back in the normal range. And her blood cultures, after we sample them, are going to be showing a reduced number or a cessation completely of the E. coli bacteria. And also if she has a temperature or else any other symptoms of sepsis are going to resolve as well.
Okay, let's get in there.
Let's do it. Knock, knock, knock.
Hello.
Miss Yarn, how are you today?
I'm good.
My name is Jared. I'm your nurse today. This will be Shelby. She shadowed me as a student nurse. How's everything going for you?
Great.
Doing great. All right. Now, Miss Yarn, we're just going to double check some things. Can I please have your name and date of birth?
My name is MARTA Yarn, and I'm 80 years old.
Thank you, Marta. We're going to double check you in the MAR. Marta Yarn, 80 years old. Perfect. Now, today we're going to do your gentamicin and your potassium chloride. Sodium chloride with potassium. Failed to mention that. Shelby, we're going to give her the potassium, sodium chloride and potassium, 20 mics in 100, because she has a history of dehydration and electrolyte imbalances. So we're going to piggyback her gentamicin off that.
Okay.
So my apologies for that. There you go. Okay. So, Miss Yarn, any pain, any change in your symptoms today?
No, sir.
Perfect. And everything going well for you here in the hospital?
Yes.
Okay, give me 1 second. I'm just going to set up everything for you. I'm going to scan you in. And one more time, no allergies for you?
No, sir.
I'll double check the band for that. And no issues with this infusion over the past few days?
No.
Okay, and they've been giving you IV every time?
Yes.
Okay, and my internet connection just went out. Hospital. Just give me 1 second, and we'll get this all situated again. My apologies, ma'am. And I'm sorry to you, Shelby. This is very unprofessional. This is the equipment that I have to work with. Very limiting, debilitating. Well, while this is reloading, I'm going to go ahead and wash my hands. And we're going to start your infusion. Miss Yarn. But I can't, because I can't even scan it in. So we're just waiting. It's called a waiting game. Can I get you to make you comfortable? A pillow, back rub, a foot rub. No? Okay. Now we are videoing this, Marta, so we can use it as a teaching video, and I refuse to stop and restart this because of this internet connection. So you give me 1 second, ma'am. We're halfway through.
Okay.
You are a great sport, by the way. We can wait. In the meantime, I'll give you some patient teaching. I usually say this for the end, but since we're going to be here for a little bit, we can do this. So the medication I'm giving you is an anti-infective or an antibiotic. And we have a history of electrolyte imbalance and a history of dehydration. Is that correct? I think I read that in your chart.
Yes.
Okay. Well, the medication I'm giving you can have side effects of tinnitus or some ringing in the ears, some vertigo, some dizziness, problems urinating. If any of these signs and symptoms come about, please let me know, or please let another nurse know, so we can change your medication and reevaluate you. Is that okay?
Yes.
Okay, now can you repeat back 2 of the signs and symptoms that I said?
You said to drink a lot of fluids earlier, and you said...
Should be in the very bottom, man. You can cheat.
Oh, you said tinnitus and vertigo and maybe hearing loss and dizziness. Is that
Absolutely.
right?
Nicely done. Good job. I'm going to leave you a copy of this right here so you can have and read it at your own leisure. There's some more information there for you. And the internet connection has came back, so perfect. Now we can continue with the medication. Okay. Once again. And Miss Yarn, I've been calling you Miss Yarn. Can I have your name and age once again so I can check it against the MAR?
My name is Marta Yarn, and I'm 80 years old.
Perfect. Okay. Now what we're going to do is I'm going to scan you in so I can give you your medications. Like I said, we're going to give you the gentamicin, IV, as well as the sodium chloride with potassium chloride. So we're going to start first with the sodium chloride and potassium chloride. Screen's blurry too. I've got to get the IT on this. This is ridiculous. Perfect. And I'm going to scan the medication barcode. We also have sodium chloride here. And just so you know, Ms. Yarn, I know it doesn't look like it, but I did prime this tube, and I kept a sterile field, even though it does not seem so right now. We do have the antibacterial cap on, or the germosoma cap on, so we're good there. And the MAR says, once again, sodium chloride, potassium chloride, 20 milliequivalents per 1,000. We double check against the MAR and your name. Perfect. We're going to scan it in. Okay. And I see that your IV was in your right hand, so we're going to continue that. And the time we're supposed to be administering it is 1600. It's now 1505. That's within an hour, so we're okay. And I know I didn't verbalize this yet, so we'll go ahead and do it. Both of your solutions are going to be clear, not cloudy. They're both in date. They're not expired. One second. And it does say IV, so we'll go ahead and do that. And documenting time, sorry. So was there something you want to say, darling? Is there a question you have?
No, I think you're doing a great job.
Okay. We put this down. Before I infuse it to you, I'm going to put some gloves on. Even though I wash my hands. Bad habits die hard. I promise not clean. Places are small. There's no largest, and they break. Again, the equipment here is so faulty. It's ridiculous. Am I entertaining you, Miss Yarn? Having a good time today?
Yes.
Very good. All right, darling. Okay, so here we go. Now, I'm going to make note that there is a bacterial cap on your IV as well, which you can't see, but I'll take that out for you, since I don't have to scrub the hub. Okay, we're going to hang this here. I'm going to set this through the pump, and just to make sure that there is a patency of your IV, before I get started, I should have done this a little bit ago. I'm going to flush somewhere. Thank you. I'm going to flush your IV. This is a sterile sealing flush. I'll take off the cap. And we're going to check for any infiltration, any redness, any pain, anything like that. So we're going to go ahead and give you 10 cc's. Any pain, Marta?
No.
Perfect. Flush is great. Okay. Good. Put that back off. So we can start the infusion. All right. Sharp container. And we'll go ahead and start. We're going to turn this on. Like I said, I did go ahead and prime and label your medication. I'm going to take off the hub cap. Not like the car. Bacterial hub. It's a long sedated tubing. Just going to register in here as a new patient. I'm going to put your name in.
Wait a minute.
I'll start your medication. Goodbye. Suppose I put this in the correct way. There.
So all that's done.
Basic infusion. And the plasma chloride is going to be 125 over an hour. And although this looks like 500 bag, it's really 1,000 bag. So we're going to do 1,000 milliliters. Ready to connect you. Unclamp you. Hopefully that stays.
Okay, then they're not a new patient. You're just you're putting in the saline, so good, no?
Okay.
I mean, I don't know.
We're going to start.
I read your thing, so I'm asking you, okay.
We're going to make sure that's running. And it drops and flows appropriately, which it is.
So, 90 channels select.
Perfect. Okay. No air bubbles. Everything was primed. No complications. Now we're going to go ahead. My internet went out again. Good Lord. Okay, I'm taking the gloves off so I'm touching my computer. I'm sorry, Miss Yarn.
Dehydrated. Is she getting sodium chloride? Okay. Okay, do you want to rate it? Okay, so you get your weight, but hit that arrow first.
Sorry for the delay, ma'am. Technical difficulties. And just skip forward. When I document everything in your chart here, I'm documenting the medication I give you, the route, the time, the continuous or injection, obviously it's going to be continuous infusion, the rate, and how you're tolerating it. Also document how the internet is not working.
Now, you have a second year, okay? You're giving her an antibiotic or something? Okay, so, this one. You can get the same time. What's it called? Okay, I'll make
There we go. Back in action.
And do you know when she's getting it? Is she doing it once daily or?
I'm not back in action yet.
Every 8 hours. She's doing it every 8 hours. So, okay. Or she, the one that's already set, the 80.
You have a lot more patience than I would.
Well, thank you, Shelby. Years of faulty equipment and being let down on a consistent basis has made me a very patient human.
Now you need, oh wait, you have the duration in there. Okay, so then you hit start.
Get it? You're a patient nurse.
I'm not.
Pun intended, I'm sure. You know, I know you are a very young lady, Shelby, and you have a bright future. But back in my day, when I first started, we had paper charting. We did everything by hand. We had do paper notation, circles, X's, lines. And I'll tell you what, it may have taken a little bit longer, but the paper never broke. Something said about that. This is still not working. But you know what? That's okay, because we're going to continue and do paper charting and simulate this working and scanning because it's not working and scanning. So I'm very sorry about that in this teaching video. So we're going to go ahead and continue because this is ridiculous. We'll figure this out later. Okay, so once again, get a new set of gloves, wash my hands.
Hit off. Yes.
Oh, let's come back up. Maybe.
You want to give me a mission? Well, I don't know. We can, I'll make it.
Okay. We'll try this again.
I think they only had it till 10.
I should use my gloves on the computer. Sorry, Miss Yarn. Last time, then I promise we'll get on with this and we'll stop doing all these shenanigans. All right. Once again, ma'am, can I have your name and your date of birth for your second medication?
Marta Yarn. I'm 80 years old.
Perfect. Check it against the MAR. You're Mark Yarn, 80 years old. Second medication to be administered, gentamicin injection, IV, piggyback.
I'm afraid this. Okay, so they're going there.
Okay. Not working. That's okay. We'll make do. Paper charting. Washing hands. New gloves.
My God. That is okay. I saw Gina's thing on Facebook too, so did she show you that? So you don't know.
Could remind me to go to the store closet and get large gloves, please? Thank you.
Oh my God.
I doubt they even have them in stock, but that's here nor there.
Just Shelby. Seriously, do not.
Okay. Now, Ms. Yarn, if we were utilizing a computer and it wasn't broken, I'd go ahead and scan your band again, scan the medication, check it against the MAR, which I can still do with the paper chart, but we can't do it right now. But I'm going to double check the gentamicin, and the dose that you had in the computer before it shut down was 80 milligrams over 100 milliliters to be given over 1 hour. So we're going to go ahead and put that in the pump. And once again, it was primed, it was sterile, there's a label on it. I'm going to take off the hub, maintain sterility. I'm going to go ahead and pause that. I'm going to hang this higher. I'm going to go ahead and put the piggyback on. Yeah. Stand by. Secondary line. All right, here we go. Put gentamicin in. B. Nope. It's down. Oy vey.
What is the jug?
Gentamicin.
Is that a G?
After F. Gentamicin. Here we go. Slippery gloves. Gentamicin. And the dose for you is every 8 hours, so we're going to go ahead and put every 8 hours. And once in 80 over 100. Ah, back. Oh. Good Lord. Sorry, Ms. Yarn. Gentamicin. Q every 12. 80 over 100. Yes, we're okay. Next, confirm. We're confirmed. Go ahead and start. Make sure we're dripping. Make sure we're all flowing. Which we are. Okay. Higher. Okay, we'll say it's working. No air bubbles, it's prime. I see it flowing. We're being administered. Perfect.
Is that on internet connection?
This?
The pump? It's going to keep working, right? Because there's no internet connection on
this
that?
will sort of, yeah, there's no, it has nothing to do with wireless anything. So we're going to go ahead and take the gloves off. Wash your hands again. Mr. Yarn, sorry about that. Technical difficulties, but we'll make it work. Just to make sure you have great patient care. Okay, I'm going to go ahead and document that. Like I said, once again, the rate, the medications, the assessment of your line, that it was an infusion, the dose, and the time, 15:05, and then everything else is unremarkable. Now, I know I gave you a patient teaching. Do you have any other questions, Ms. Yarn, or any concerns?
No, sir.
All right, I'll make sure this internet connection is fixed and everything's ready to go before we come back in. If you need anything, give me make sure to hit your call button. Let me know. I'll come back in. I'll let the IV go, and we'll assess you and draw your levels after it's administered. Okay?
Were there any pertinent pieces of information you reviewed before administering the client the medication?
There was, Shelby, actually, yes. I went through and checked her vital signs, and I also did, like I said before, I checked her lab values to make sure she wasn't having any kidney problems, any renal problems. And I checked for her blood culture as well to double check that she did in fact have the bacteria infection that coincided with the proper anti-infector antibacterial.
Did this information affect your decision to administer the medication?
Yes, because if for some reason it was the wrong kind of bacteria on this type of antibiotic, I went to work, I went to administer it. I checked to see if it was an IV, piggyback IV infusion, which indeed it was. I checked to see if she had it before, if there's any complications. Had it before, no complications, so we were good to go.
Did this information affect how you administered the medication?
It did not. The chart was for an IV piggyback, so we gave an IV piggyback, and that's what she had before. That's what we'll maintain if she can tolerate it throughout her stay here.
Okay, thank you so much. Hopefully they get this internet problem fixed.
Absolutely. Thank you so much.